Aloha. Thank you all for taking the time to listen to my presentation today. My name is Erin Evangelista, and I'm excited to share my capstone program design called Arthritis Education Through Community Bonds, or AECB. Here's a short overview of what I plan to talk about today. First, I will explain what the program is and its goals. Second, I will go into detail about the foundational concepts surrounding AECB. Relevance will then focus into why this program is necessary. Then we will talk about how the program is designed, what the expected outcomes are, and along with its broader implications. So what is AECB and its goals? Since this is a program specific to the Arthritis Foundation, I wanted to make sure that the program's goals and mission aligned with the Foundation's. Their mission focuses on working together to conquer arthritis with life-changing science, resources, advocacy, and community connections. AECB goals touches on resources and community connections specifically. From this program, we hope to provide more educational resources for Native Hawaiians and Pacific Islanders, and to use these resources to foster community connections between the Arthritis Foundation and Native Hawaiians and Pacific Islanders. We are hoping that this program will increase participation and epidemiological diverse representation. Talk story is a term that permeates all throughout Hawaii. Talk story is pidgin for talking with friends, passing time by chit-chatting, or rekindling the times. It is such an important part of Hawaii culture, and it touches on how people learn about each other. In fact, people appreciate talking stories so much that the city and county of Honolulu hosted a talk story festival. For Native Hawaiians and Pacific Islanders, there is a weighted importance on connection to time and place. This means that individuals appreciate and look back on their life experiences, along with appreciating and learning about others' experiences. Where people come from, how they ended up there, when they were there, and what their experiences were in those areas. These are all incredibly important to Native Hawaiians and Pacific Islanders. In order to create and strengthen community connections, AECB aims to use this method of talk story to improve how Native Hawaiian and Pacific Islander patients tackle arthritis. Now I will go over the foundational concepts that form the core ideas and challenges facing public health and the program. One important concept, if not the most important concept I've learned from my time as an HPU public health grad student is social determinants of health, or SDOH. It states that health is impacted in the way that we as humans grow, live, work, age, worship, and etc. Health is defined as the state of complete physical, mental, and social well-being. Considering these definitions, I think about how, since everyone grows and lives differently, that means people have unique opportunities to achieve health. This is what we call health inequities. It is the differences in opportunities to reach the optimal level of health. AECB aims to tackle differences in education and to adjust these methods to be more appropriate for the NHPI culture. We do this by looking at the history and its culture from the past and learn to adapt to their community context. Understanding these determinants in NHPI arthritis management, the program can be designed in a way that tackles these determinants to reach health equity. Keeping that in mind, here is how I plan to design the project. The program is scheduled to occur every quarter in the year. In that month, one class will be held every week for 4 weeks. Tentative months I have in mind are January, April, July, and October. Each 40-minute to hour session will include exercise and time to talk about their experiences concerning their time with arthritis. The educator, which is typically a healthcare professional, and volunteers will help facilitate the class to encourage the group to feel comfortable expressing their time with arthritis. The program aims to break out of the lecture educational norm and into a more interactive roundtable discussion. This is where the talk story method comes into play. Now, how is the program relevant for the NHPI community, and what's the point? The program is relevant for NHPI in 4 aspects: epidemiological, behavioral, educational, and social. Epidemiological assessments of the program include seeing if there was a diversity, equity, and inclusion impact from the program seen in the participation of more NHPI and data collection. Increased data means increased research from Hawaii organizations and the Foundation. Behavioral is the introduction of beneficial lifestyle habits for those with arthritis through the lessons in the class of exercise and diet. Educational aspects ties into this health behavior change, where more NHPI members are able to have more resources on learning about arthritis. Lastly, in a state where locals value the strength in our culture, we see time and time again agitation when someone does not respect the aloha spirit we practice. In terms of social assessment, the relevance of this program shows that the Arthritis Foundation, despite first starting in the mainland, desires to further be culturally competent and that they can adapt to our island life. This establishes trust and openness to receive more help from the Arthritis Foundation. So what do we want to see at the end? For Native Hawaiians and Pacific Islanders, we expect to see improvements in lifestyle habits and change in health behaviors, which will be assessed at the end of each month's session. We would like to see more people utilizing the Arthritis Foundation's health education opportunities, along with the resources used to connect with other patients around the island. For the Arthritis Foundation, we would like to see at least 1% of Hawaii's population impacted. There are roughly 240,000 people living on the islands, and we expect to see at least 2,400 participants impacted. From our data, including more participation from NHPI, we expect to see more diverse impact and event participation around the islands. For the greater public health community, they will be more culturally competent by being involved with various professionals in the field, thus becoming more open-minded to other determinants which may impact someone's health. Overall, collaboration is our expected outcome from AECB. Lastly, what does this imply for the greater public health community now and in the future? For our next steps, as arthritis education through community bonds grows, we want to improve the curriculum and the scope of the people touched. This means to take suggestions from the participants and to venture out more into neighboring islands. We are starting off the program in Oahu, but we would like to see a greater scope of participants and patients. The success of this program can be used for other medical conditions that are more prevalent in the NHPI community, these being diabetes, asthma, hypertension, cancer, and obesity. Again, as mentioned before, increased participation in the program means more research, greater awareness, and more resources for the health professionals to join in the Arthritis Foundation's battle in conquering arthritis. The program will show that successful teaching methods may differ across cultures and communities and displays the importance of adapting to these educational needs. Overall, AECB will boost the significance of the public health field, eventually leading to achieving health equity in collaborations with other programs, people, professionals, and patients. Here are my references. Thank you so much for taking the time to listen to my presentation today. I really appreciate it, and I'm looking forward to all your questions. Mahalo.